Good afternoon. I'm Cindy Hall, president of the Women's Congressional Policy Institute, WCPI. Welcome to this afternoon's briefing, Reducing Maternal Mortality in the United States. Thank you to those of you who are attending in person, and welcome to those of you who are joining us virtually via live stream. As most of you know, WCPI is a nonpartisan, nonprofit public policy organization whose mission is to bring together a community of bipartisan women policymakers and trusted partners to advance issues of importance to women, develop the next generation of women leaders, and foster a more effective and representative democracy. We work closely with the members and staff of the Bipartisan Women's Caucus. Today, we will be hearing from a very distinguished panel, including Dr. Janine Austin-Clayton, Dr. Terry Major Kincaid, Stacy Brayboy, and our moderator, Jasmine Reed. Each will be bringing a different perspective to this important discussion, and we thank them for participating. Our special thanks to Procter & Gamble and Pampers for their support for this briefing. We appreciate their commitment to reducing maternal mortality and improving maternal health outcomes. I would like to thank our congressional briefing co-sponsors, the leadership of the Bipartisan Women's Caucus, Congresswomen Pat Kamak and Susie Lee, co-chairs, and Congresswomen Monica De La Cruz and Amelia Strong Sykes, vice chairs. We will be posting live on social media during the briefing. We encourage you and others to do so by using the hashtag WCPI Health. I am now pleased to introduce Congresswoman Pat Kamak, Republican co-chair of the Bipartisan Women's Caucus. She is in her second term representing the 3rd District of Florida. She serves on energy and commerce and agriculture. Among her many priorities in Congress, Congresswoman Kamak is a strong advocate for maternal health and announced maternal mortality as one of the Bipartisan Women's Caucus priorities last month.
One of the challenges of being 5'3" in Congress is all the podiums are basically your height. So, and as someone who favors flats over heels, sometimes this is a challenge, but I think I'm safe in this room talking about footwear for sure. Y'all recognize the struggle is real. But I want to thank everyone for being here. I recognize that today is a fly-in day, so a huge shout out and thanks to my colleagues for being here. It was funny, I ran into Monica yesterday on the sidewalk and I was so excited that you were going to be here because this is such an important topic. And often in the news, we hear about the divide, the gridlock in Washington, D.C., but leave it to the women to have found an area of common ground. And not just when we're talking about infant mortality and maternal health, but in so many other areas. So I am so pleased to be able to be with you today to talk about this very important issue. As Cindy said a few months ago, we announced that the Bipartisan Women's Caucus would be discussing the top priorities and what we wanted to tackle collectively this Congress. And with so many new faces joining the ranks in Congress, both as Republicans and Democrats, it was encouraging to see so many of us come together on a collection of different issues. And I have to tell you, in that meeting, we talked about maternal health, we talked about maternal mortality, infant mortality, and the issues that had seemed to persist for so long with not a large voice at the national stage. And so it was a very easy lift for us to say this is going to be a priority. So I am particularly proud to be the co-chair for this Congress's Bipartisan Women's Caucus. And I will say, you know, when I see the statistics of how many women and children that we lose every year, I know that my heart breaks, but certainly hearts collectively break around the country. We need to find better solutions. And even though I'm not yet a mom, my husband, Matt, who is a firefighter back home, you know, he looks like Mr. Bean, but the sexy firefighter edition. It works. Don't ask me how. Maybe it's the Fu Manchu thing he's got going. I'm not sure. But you know, we've talked here over the last couple of years about starting our own family. And So this is an issue that is becoming more and more personal to me as we embark on our own journey of starting our own family. So I'm looking forward to learning more, because certainly as a millennial, as a woman, and now a legislator, I can say that you don't know what you don't know. So I'm so thrilled for the experts that we have here with us today to learn more. I want to thank Procter & Gamble and Pampers for joining us here today, sponsoring this event. I am so proud of my colleagues, Representative Sykes, as well as Monica de la Cruz. And I'm looking forward to, and see, I did it your way. Yeah, I did it your way. I wasn't gonna do it. I represent a very rural part of Florida. So, we say things like madder than a termator and a termator patch, real thick accent, but I can still, Florida, hey, listen, we can throw it on there. I'll do it for you. But I'm so grateful and so proud to serve alongside you both. And I would be remiss if I didn't mention Representative Susie Lee, who wasn't able to make it today. As I said, we have votes tonight, but it's a fly-in day, so everyone's schedule's a little crazy. But again, thank you so much for everyone for being here today. Looking forward to a wonderful luncheon. Thank you again to our amazing panelists. And thank you for coordinating on the colors today. We've got the jewel colors rocking today. But most importantly, I am excited to identify and learn about some bipartisan solutions that we can champion moving forward as we discuss this very emotional and important topic today. So thank you.
Thank you so much, Congresswoman Kamek, for your remarks and leadership. And thank you also again to Congresswoman Monica de la Cruz, who has joined us, and we didn't expect her, and we're thrilled she's here. I'm next pleased to introduce Congresswoman Amelia Strong Sykes, Democratic Vice Chair of the Bipartisan Women's Caucus. Congresswoman Strong Sykes represents Ohio's 13th district and is in her first term. She serves on the Science, Space, and Technology Committee and Transportation and Infrastructure Committee. Her priorities include improving maternal and infant health and expanding the maternal health workforce, which she championed as minority leader of the Ohio State House before coming to Congress. Congresswoman.
Good afternoon, everyone.
Good afternoon.
I, like Congresswoman Kamek, am only 5'2", and also experience some challenges behind podiums. And perhaps that is one of the things we can take up as the Bipartisan Women's Caucus, the disparity in podiums, chairs, furniture that is not set for smaller statures like ours. But again, just want to say thank you to all of you who are joining us today for this very important topic, one that is very top of mind for many of us for many reasons. And thank you, Cindy, for that introduction. And of course, to you and your team for always organizing such wonderful meetings and meetings of substance primarily. Again, my name is Amelia Sykes. And just so you all know, Strong is my middle name. It's not a second last name. It is my mother's maiden name. It is not my security question, by the way, because it is very clear. So it's not Strong Sykes, it's just Sykes. And I am honored to represent the birthplace of champions, Ohio's 13th Congressional District. And it is truly an honor to be with all of you today as we're acknowledging and talking about women's health and how we can do better for them as members of Congress, but as well in our respective places in our world. Again, so honored to be here with Kat Kamek, who, go Gators, can talk about a little bit of Florida with you. And this is such an important issue. It's not a partisan issue. It is a human issue. And the fact that the Bipartisan Women's Caucus, alongside with my Democratic colleague, Susie Lee, who is from Nevada, so she had a little bit longer flight to get here, as well as Monica de la Cruz from Texas. Thank you so much for your work. And while we certainly represent different states with different communities, we can come together every once in a while. And it is the mission of this organization to do so for issues that matter the most to us. And one of those is ensuring that people have healthy, happy lives. And that requires access to quality and affordable health care at every stage of life. As a lawmaker and someone with a public health background, but most importantly, as a Black woman, I know that too many people who look like me face significant and sometimes deadly obstacles into getting the quality they care that they need when they're looking to start or grow a family. In Ohio, these obstacles have devastating impacts on Black moms and families and our babies. Our state ranks amongst the worst for infant mortality, as well as for maternal mortality. In fact, in Ohio, Black women are 2 to 3 times more likely than white women to die from pregnancy or while giving birth. And as heartbreaking as it is, what's so maddening as this crisis is that it is mostly preventable. For far too long, we have talked about addressing social determinants of health and those quality of life indicators that deeply impact one's health and well-being, but we really haven't done enough because far too many mothers and babies are dying. In Ohio and across the country, inequities amongst determinants of health have led to significant racial disparities that harm communities of color. And we know that closing these gaps and increasing access to quality, affordable pre- and postnatal care can ensure healthier moms and babies and certainly save lives. I'm going to go a little off script here because in public health, we always talk about things being predictable. If they're predictable, they're preventable. Maternal deaths are predictable, which means they're also preventable. But we also talk about these things called protective factors, and I'm sure our panel will talk about them. And often when we discuss racial health disparities, people immediately look at the disparities are due to poverty and lack of access and lack of dollars and healthcare interventions that make sense. But one of the things that we have found that is especially troubling for maternal and infant deaths is it does not matter what risk factors exist or what protective factors exist. It is the mere fact that your skin is Black or you're a person of color that makes it worse. And the statistics show us that even Black women of higher socioeconomic statuses have lower and worse health outcomes than white women who graduated from high school. So it is not merely how much money or access you have. It is unfortunately the color of your skin. And if you don't believe me, just ask Beyonce, because I know her personally, of course, or Serena Williams about their birth experiences that they had. It is simply not just how much money you have, because if that were the case, they would not have had such horrible experiences. As Cindy mentioned, as a former minority leader of the Ohio House, I helped create the first ever state level Black Maternal Health Caucus. It was in order to improve infant and maternal health in Ohio. And now in Congress, I'm excited to continue these efforts by being a member of the Black Maternal Health Caucus led by Alma Adams and Lauren Underwood of North Carolina and Illinois, respectively. And as members of the Black Maternal Health Caucus, proud to be a co-sponsor of HR 959, the Black Maternal Health Momnibus Act, which makes critical investments in social determinants of health that influence maternal health outcomes like housing, transportation, and nutrition. All of these bills and the funding to community-based organizations that are working to improve maternal health are so important. They help promote equity, but most importantly, we're saving lives. And I'm confident that regardless of our political parties, we can work together to improve the health outcomes and deliver on the promise of better lives, healthier lives, and brighter futures for all of us. The final thing I'll say is we are all preparing to recognize and celebrate our mothers this Sunday. But unfortunately, for far too many families across this country, there is not a mother on earth that we can celebrate. That woman may have died in childbirth or shortly thereafter due to very preventable conditions. And the work that we do is for them and for those families and for those little ones who have to grow up without a mother to care for them, to wipe their tears, to give them a Band-Aid when they have a boo-boo. So this work is important. It is emotional. It is necessary. And I'm so grateful to be with this group of women, making sure that we're getting it done and doing it right. So thank you again. And Cindy, I'll give the program back over to you.
Thank you so much, Congresswoman Sykes, for your very thoughtful remarks and your leadership, of course. I am now pleased to introduce Jasmine Reed, who will introduce each of our speakers and moderate the discussion. Jasmine is Senior Communications Manager for Procter & Gamble North America Baby Care. In this role, she focuses on equity and inclusion, brand communications, and digital content innovation. Over the past few years, she has developed meaningful campaigns for multicultural audiences, owning transformative social media strategies, and advancing Pampers' maternal health equity program, an initiative focused on changing the systemic issues that prevent Black moms from receiving equitable care. Jasmine.
Awesome. Thank you, Cindy. Hello, everyone. It's so wonderful to be with all of you this afternoon, and it's amazing that we'll get to hear from 3 awesome panelists on ways that we can advance maternal health equity in the US and how we can work together to drive change for this issue. And so it is my pleasure to welcome our first panelist, Dr. Janine Austin Clayton. Dr. Clayton is Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health at the National Institutes of Health. She is the architect of the NIH policy requiring scientists to consider sex as a biological variable across the research spectrum. As co-chair of the NIH Working Group on Women in Biomedical Careers with the NIH Director, she also leads NIH's efforts to advance women in science careers. Prior to joining the ORWH, Janine was the Deputy Clinical Director of the National Eye Institute for 7 years. She is also the author of more than 120 scientific publications, journal articles, and book chapters. Amazing, you are busy. So Janine, the time is now yours. We look forward to hearing from you.
Thank you so much, Jasmine, and thank you to everyone for being here and to WCPI for hosting this event. We have an opportunity today to talk to about a critical issue affecting women in the United States. As the director of the NIH Office of Research on Women's Health, I am deeply committed to promoting the health and well-being of women across the lifespan and ensuring that the evidence we generate through research reaches all women. Before, during, and after childbirth, women in our nation are dying at higher rates from pregnancy-related and associated causes than in any other high-income country in the world. Even more alarming, maternal mortality rates have increased since the start of the pandemic, shown on the slide here. The maternal mortality rate for 2021 was 32.9 deaths per 100,000 live births, compared to 23.8 in 2020. That is a 40% increase in a single year. In 2021, 1,205 women died in the United States, compared to 861 the year before and 754 the year prior to that. Although this particular report I'm highlighting here focuses on death within 42 days of the end of a pregnancy, it is important to note that more than half of deaths happen up to 1 year after delivery. And we know that for certain women, the risk is greater, regardless of income level, regardless of education. Black women are nearly 3 times as likely, and American Indian and Alaska Native women are more than twice as likely to die from pregnancy-related complications than white women. And even among Black women with at least a college degree, as you heard from Representative Sykes, the pregnancy-related mortality rate is 5 times higher than that of their white counterparts with similar levels of education. And for women who live in rural America, where there are many maternity care visits, they are 60% more likely to die. And if you remember only one number that I've said today, please remember this: 80%, 4 out of 5 of these deaths are preventable. According to the latest data, the leading cause of maternal mortality in our country is mental health conditions, including overdoses. That accounts for nearly 1/4 of the deaths at 23%. Interestingly, the leading cause of maternal mortality varies by racial group. Mental health conditions are the most frequent underlying cause of death among Hispanic and white women, while hemorrhage is the most common cause among Asian women, and among Black women, heart conditions are the leading cause of maternal mortality. It is essential that we address these disparities. We have the knowledge, the tools, and the resources to save lives. Our challenge is to work together to ensure that every woman receives high-quality, evidence-based care through pregnancy, childbirth, and in the postpartum period. We also have to recognize that systemic inequities and differences in how people are treated based on who they are or where they live contribute to these disparities in maternal health outcomes. These factors are associated with disparities in how women experience the healthcare system, disparities that too often can be a matter of life and death. So NIH recognizes this problem, and we have rallied around this issue, this critical public health crisis, building upon our previous investments. And fiscal year 20, NIH launched this new agency-wide initiative called the Improve Initiative to support research on how to mitigate preventable maternal mortality, decrease severe maternal morbidity, and promote health equity. In fiscal year 20, we focused on the major drivers of mortality: cardiovascular, infection, and mental health, awarding about $7 million in supplements to 36 projects. The next year, without additional funds, NIH rallied and focused on the impacts of COVID-19 on maternal health, with particular attention to the impact of discrimination and structural racism on maternal health outcomes. We've awarded then over $13 million to 22 projects, and we are extremely grateful to Congress for appropriating $30 million in fiscal year 22 to fund the Improve Initiative and to create a new national network of maternal health research centers of excellence. Improve has also supported the other pieces of that puzzle on the right. They're designed to work together. A connect-a-thon, which engages stakeholder communities to develop technologies that standardize care and data available in electronic health records. That's going to facilitate automated methods to identify a pregnancy health record, link a mom and baby's record to each other, and enable real-world research. The community implementation program of Improve exemplifies our focus on community engagement by ensuring that evidence-based interventions promoting maternal health are delivered, accepted, and actually utilized for all individuals, especially in communities of greatest need. And this program, we're also funding community-based coalitions to pilot test the implementation of effective interventions that improve maternal health outcomes. We're working with patient advocacy groups and SMEs to help the program achieve community-informed goals. The Connecting the Community for Maternal Health Challenge launched in August of 2022 to help community-based nonprofits develop the infrastructure and capabilities to pursue maternal health research in areas that specifically impact their communities. The challenge is targeted training and financial incentives to these community-based organizations with a total prize of $3 million distributed across multiple phases. And similarly, the RADx Tech for Maternal Health Challenge was launched in fiscal year 22 to establish a robust research and development pipeline via an innovation funnel to speed development of new products. Sharing in a prize pool of $8 million, innovators continuously compete to accelerate the development of home-based and point-of-care postpartum maternal health diagnostic devices, wearables, and other remote sensing technologies. These are so important to enable extension of care and ultimately reduce severe maternal morbidity and mortality for individuals who reside in maternity care deserts. So these maternal health research centers of excellence right in the center of that diagram are the centerpiece of the Improve Initiative. They are going to include up to 7 centers, a data innovation and coordinating hub, and an implementation science hub to collaboratively design and implement research projects that are going to address biology, behavior, environment, sociocultural, and structural factors that affect maternal morbidity. The Maternal Health Research Centers of Excellence Initiative will ultimately leverage each of the Improve components, as well as the strong community connections we're building to work towards reducing maternal morbidity and mortality in the United States. I look forward to our question and answer session. Thank you so much for your attention.
Awesome. Thank you, Janine. We appreciate hearing about the important work that the NIH is doing to address, maternal mortality, severe morbidity, and really impacting positive maternal health outcomes. So thank you. And now it is my pleasure to introduce our next speaker, Dr. Terry Major-Kincaid. Dr. Major-Kincaid is a double board certified neonatologist and pediatrician with over 22 years of experience. She recently started a new position as Associate Professor of Pediatrics, Director for Pediatric Hospice and Palliative Medicine at UT Health Houston, McGovern Medical School. Dr. Terry, as she is called by her friends, has led several outreach initiatives to improve maternal and neonatal outcomes through partnerships with the March of Dimes. And she serves on the National Board for the Pregnancy Loss and Infant Death Alliance and the Pampers Womb to World Advisory Board. She also is a two-time best-selling author. Welcome, Dr. Terry.
Hello, friends. You guys can call me Dr. Terry too. I hope we're friends now, that we'll be friends after this is over. So I would just like to share a few things about myself and what brought me to this work, and a little bit about why I'm so passionate about it. The first thing I'll start with is people are usually surprised to find out that I'm not an obstetrician, but I'm passionate about maternal mortality. And you know why I'm passionate? Because I'm a neonatologist, I'm a pediatrician, and the last time I checked, babies come from moms, moms come from families, families come from healthy communities. So for me, my ideal day will be when nobody is in the ICU nursery, nobody has to say goodbye to their mom, their wife, their sister, their aunt. Nobody has to say goodbye to their baby. So I want to just start by thanking the WCPI for having me here today to share something I'm so passionate about. If you look on this slide, you'll see two cute little brown babies sitting on a couch. I hope you think they're cute. The youngest one is my sister. She was a preemie born in 1968. She was not supposed to survive. She was born a couple of years after President Kennedy lost his own son to prematurity because neonatal intensive care had not been established. She's the reason why I wanted to be a neonatologist. I was fascinated about holding a human in my hand, and a human that was in a plastic box that could eventually come home. So that is what motivated me to pursue a career in medicine. I'm from Baton Rouge, Louisiana, from a zip code that would tell you today that I should not be here. And if you don't understand anything about disparities, what I want to say is a disparity is a difference that should not be. And I should not be in the United States knowing your zip code, being able to tell you today what you're going to die from. And in the United States, we actually can tell you that from your zip code. If you look to the left of that, you see a book called Capital Crime, Black Infant Mortality in America. And below that, you see me getting my degree from UCLA. I had the chance to read that book my third year of medical school in my public health course. And I was offended by the title. I was like, how dare you guys name this book Capital Crime? Like, it's not like it's murder. And then when you finish reading the book and you learn that there were zip codes in New York City that have infant mortality rates worse than some third world countries, you understand how serious this is. I learned about this statistic in 1993. I was horrified. I delayed graduating from medical school to get my master's in public health to pursue ways that we could address this issue, thinking by the time I have my family, this will be solved. And here we are. So I'm so grateful to be in the room with you guys today. The next paper I read said that a Black woman with a college degree was 2 times more likely to have an adverse outcome. And I'm like, I'm working on my 3rd degree. What is up? Like, what? What about me? Like, I'm horrified. And so I am so passionate about this. The places where we live, work, and play every day, the social determinants of health, impact our outcomes. I'm doing what I can in the hospital from the bedside, but when people leave and go back to communities that don't have resources, they don't have access, they have to drive 2 hours to get to a physician, or they see a provider who looks at them and they don't see their mother, their sister, their aunts, we are not going to be able to improve these outcomes. On the bottom, you will see a raccoon smiling at you. And my daughter just graduated from veterinarian school from Tuskegee this past weekend. Yay, Dr. Ting. And so she's holding a raccoon there. The raccoon was actually purring, but that would have been too much to show y'all today. But when I think about my daughter, who now has her 3rd degree, and I think about my future grandchildren, I want them to be here. I want every woman in America to have the opportunity to have a healthy pregnancy. We all deserve that. We want every child to make it to the 1st year of life. You should not feel like you have to be in Norway, Spain, or Poland to have a good outcome. We live in the richest country in the world, and we can fix this. The last thing I want to end with is a lot of barriers to improving maternal mortality and infant mortality in the United States, we know are related to provider bias. We know that bias creeps in and affects decision-making, even when we have protocols in place for how women should be treated. We know that Black and brown women have said, I am saying I don't feel my baby. I am saying I have a headache. I am saying my legs are swollen. I'm saying something is wrong, and they are being dismissed. And that's related to bias. So I'm here today to say that we all have bias, just like say it with me. We all have bias. Dr. Terry too. Y'all can say it, it's okay. And I have my next slide is just a quick exercise to show you guys how quickly bias can creep in before we even have a chance to catch up to what our brain is doing. So for those of you who can, I want you to just take a few seconds to see if you can read this paragraph. Just a few seconds or so. I heard somebody say, how many of you guys found that pretty easy to read? It's pretty scary, right? Every word in this paragraph is spelled incorrectly. And it's an example of how amazing our brain is, how amazing our mind is. We are constantly getting signals, images, experiences that formulate the way we approach life. And our brain puts it together and allows us to make a decision. And sometimes our brain does that when we're taking care of patients based on images, things we've heard, facts that are not clear, a snap decision, and we make a decision about someone that deviates from standard of care. So I want you just to think about that. I'm super excited to be here with you, super excited to collaborate with you, and I can't imagine a better way to spend my morning. Thank you for having me here today.
Thank you, Dr. Terry. Thank you for that personal story as well about your journey to this space. And we appreciate the work that you're doing to advance maternal health equity. Awesome. Well, next, I am pleased to welcome our final speaker, Ms. Stacey Brayboy. Stacey is the Senior Vice President for Public Policy and Government Affairs at March of Dimes. She leads the organization's development and execution of federal and state government affairs and public policy agendas, overseeing a national plan. Prior to joining March of Dimes, Stacey served as Director of the Office of Intergovernmental Affairs for the Commonwealth of Virginia, having been appointed by Governor Ralph Northam. She also served for 8 years in the Obama administration, holding several leadership roles in the Department of Agriculture. Welcome, Stacey.
Thank you. So good afternoon. And thank you. I want to first thank the Women Congressional Policy Institute and the Bipartisan Women's Caucus for having me have the opportunity to join you this morning or this afternoon to bring greetings on behalf of March of Dimes and share with you what our efforts have been and how my job, according to Cindy, is to tie it all together. And so when I talk about what we do at March of Dimes, what my role is and what we're passionate about, you will see how the thread has been, the thread is weaving through each of our presenters today. March of Dimes was founded 85 years ago as an organization dedicated to eradicating polio in the US. And today, we continue that fight. We look at addressing some of the biggest issues and challenges that we're facing in our country today. We do this by looking at research, focusing on advocacy, and not only focusing on advocacy, but on how do you educate and what do you do to advance programs in terms of how it impacts maternal and infant health. And so I always start by saying, we advocate and fight for moms and babies. And so everybody has a mom. Everybody comes from a family and everybody comes from a community. And why it is important for us, when you leave here today, the takeaways are, how do you go back to your congressional offices? How do you go back to your communities? How do you begin to advocate? How do you begin to look at how you take the experiences and the information that has been shared with you to bring about change? And how do we address the maternal infant crisis that we're dealing with and facing here in our nation? As the nation's leading maternal and child health advocacy organization, March of Dimes works at the local, state, and at the federal level, addressing key issues affecting maternal health, pregnant women, infants, children, and families. We focus on advancing health equity, fighting for families, no matter who they are, where they live, or what they can afford. The advocacy and making sure, as you've heard Dr. Terry say, not look at what your zip code, being able to define what your outcomes will be. We're facing a national crisis, which is dangerously high maternal mortality rate. In 2021, the CDC found that over 1,200 people died from maternal health causes. And that's an increase of 40% since the year 2020. March of Dimes focuses and reports on what we call a maternity care desert report that is put out every year. We have a new one that will be coming out in June of 2022. We also do extreme research, extensive research on what we call the maternity care report card. In that report card, it looks at where you live, it looks at your state, it goes down to what your zip code is, and there's a grade that is given to each of those states regarding where they stand in regards to maternal health care. In the US, our 2022 March of Dimes report card rated the US with a D. That D is earned by looking at, in 2021, the premature preterm birth rate in the US rose. It rose to 15-year high in 2020. That's a 10% with a 4% increase from 2020. The facts, those statistics that I'm providing and the statistics that the panelists have also joined me with providing shows that we have what? It confirms that we are one of the most dangerous advanced countries for a place to give birth in a developed world. Pause, just think about that. Here in the US, we've experienced a long-standing health disparities, and these long-standing health disparities have put Black people, minorities, women at an increased risk because of systemic health and social inequities. This includes insufficient access to healthcare, insufficient access to economic and social and environmental and structural racism. All have shown to have an impact. In the March of Dimes 2022, our annual maternity care report, Nowhere to Go, maternity care deserts across the US have report shows that 2.2 million, that's 2.2 million women of childbirth age live in areas in this country that are considered to be maternity care deserts. And you may ask, well, Stacey, what exactly is a maternity care desert? Well, I'm glad you all asked me that question. A maternity care desert, it means that there's a lack of access for maternity care resources. That means there's no hospitals, there's no OBGYN, there's no obstetricians, there is no doula coverage or care that is in that area. Hard to believe that we have maternity care deserts in one of the best places to live. And despite the statistics that I've shared with you and our panelists have shared with you, I want to share with you some congressional wins that March of Dimes wants to point to. Not congressional wins that we have been able to successfully gain on our own, but we've been able to do it because of partnerships, because of other healthcare advocacy groups, and all of us working closely together to look at ways that we can encourage Congress and ask Congress to look at how you address this Congress. How do you address this crisis in this country? What are some congressional wins that I just want to highlight for all of you? Bipartisan congressional wins. Medicaid postpartum extension. I'm happy to share that on yesterday, we learned that Missouri actually became the 33rd state that actually extended postpartum Medicaid extension. We need your help to continue to encourage other states to sign on to what Congress has signed on and to put into place. I won't only just say states, I want to be corrected. I want to also say 33 states, including DC, have implemented Medicaid postpartum coverage for 12 months. Doing maternal mental health, we've looked at and we've seen laws that have passed that have come in to address some of, in light of Maternal Mental Health Substance Use and Disorder Act being passed. I also want to highlight at the end of last year, Congress, doing a bipartisan effort, passed PWFA, which is the Pregnancy Workers Fairness Act, and the PUMP Act. And these were laws that guarantees the basic accommodations for women in the workplace to be able to take a break. Can you imagine working and not being able to go to the restroom when you've got a baby pressing on your bladder? Or not being allowed to take a drink of water or to sit on a stool? So some of the basic things that we take for granted, pregnant women were not allowed to be able to do in the workplace. So we congratulate, we thank Congress, we thank the president for signing into law, PWFA, and also the Pump Act, having the ability to stop if you've chosen to nurse, being able to do that while you are at work and being able to have accommodations to be able to have that take place. Now, you may say, Stacey, now you've told us about all the wonderful wins that Congress has done last year. So we're here today to talk about maternal mental health, maternal infant health, and what we can do. Let me share some new opportunities that Congress has before them and things that we all can work together. And I wouldn't be in the position I am leading government affairs, public policy, and advocacy if I didn't have a call to action for all of you. So with the new Congress, we have new opportunities. And with these new opportunities, we have bipartisan ways to get these things done. You've heard from our congressional leadership that maternal and infant health is one that we all can get behind. We can work together to advance a few things that are coming up that we're advocating for at March of Dimes, along with some of our healthcare providers and some of our healthcare partners. Black Maternal Health Week, Black Maternal Health Momdibus Act. I've heard a little rumor, and I'm sure a few of you've heard this rumor too, that legislation, and I see the Congresswoman smiling, that you've heard that this legislation will be reintroduced this week. I think, and I would encourage you all to reach out to your congressional members and encourage them to support the reintroduction of the Momdibus. What is another piece of legislation that I would encourage you all to get behind, to advocate for, is I've heard a rumor that there will be reauthorization of the Preemie Act being reintroduced. Now, don't say I said it. I realize it's being live streamed, but we could do our research. But what I would ask you all to do again is when that legislation is reintroduced, encourage your members of Congress to join on and support and sponsor. What is the pre-authorization? What is the Preemie Reauthorization Act? This bipartisan bill is up for reauthorization in this Congress. It will strengthen and expand federal research programs dedicated to preventing premature birth. We've got other opportunities to look at other potential legislation that focuses on stillbirth prevention. That would include the Shine for Autumn Act, as well as Maternal and Child Health Stillbirth Prevention Act. And finally, I'd want to mention advancing safe medication for moms and babies. This is also bipartisan legislation that will help advance our understanding of the effects of medication on pregnant and lactating women and infants. Now, I told you I was going to end with a call to action. And my call to action, as I've kind of weaving through my entire comments, is for you to make sure that you go back to your states. And I know when you're here, and we're here on the Hill, you focus on exactly what Congress can do. Not only talking to your congressional members, but reaching out across the aisle and encouraging your congressional members to talk to other congressional members to support these bipartisan pieces of legislation. But I would also encourage you, because I wouldn't be who I am if I didn't encourage you to go and talk to your nation's governors. For whatever state you reside in, wherever your mama, your daddy, your uncle, your cousins, your community is, to go back and reach out to those governors, to those offices, and ask them if they're not one of the 33 states that have signed on and taken advantage of the 12 months extension, that they sign on to Medicaid extension, postpartum extension. I cannot stress enough how important it is for members of Congress to reach across the aisles to work together to address maternal and infant health. But it is equally important for each of you to accept the charge to go back to your desks, go back to your offices, go back to your organizations, and encourage everyone to take an active role in making sure we encourage our congressional members, our leadership, to work in a bipartisan way so that we can address this crisis that's impacting our moms, our families, our infants, and our children. Thank you for this opportunity.
Thank you, Stacey, for those thoughtful remarks and sharing those recent bipartisan wins and ways that we can support. And thank you to each of our speakers for your presentations. And I hope that you all continue to be uplifted as you're doing this challenging work and as we step alongside you to support. And so now I'd love to open it up for Q&A time. And so I'd like to first invite any of our Hill staff to ask their questions. And I think we'll have someone with a mic going around. Please. Question over here.
This just comes from like a personal experience I had with a friend who died from preeclampsia, actually. So I was wondering, like what you all think needs to be done about that to prevent deaths like from preeclampsia from happening.
Dr. Terry, Dr. Clayton.
I'll start with just the information and then maybe pass it to you for the delivery. So it's critically important that information is available to everyone. So the HHS, Health and Human Services.gov, womenshealth.gov website has a lot of information, and we have information as well on the NIH maternal mortality web portal. We have information for researchers, for policymakers, and for women who are pregnant. So we're working to get that information in a place that's easily accessible and free and freely available. However, just because you have the information doesn't mean that you have enough of an understanding to know when to make that call to seek help. And that's really important. And I'm going to pass it to my colleague, Dr. Terry, to pick up for when to seek help and what that looks like.
Thank you so much for your question. I love your question. One of the things I think is really important is the best time to start planning for a healthy pregnancy is a year before you're actually pregnant. And I don't think we drive that message home enough. One of the ways that I have found to be really impactful for empowering particularly marginalized communities is partnering with our community stakeholders to get this information out there. So in Texas, we've been able to do initiatives with Black churches. We've been able to do initiatives with HBCUs. We actually had an HBCU bus go around to all the colleges focusing on preconception health, interconception health. You're not pregnant now, but when you are planning for your pregnancy, these are things to look for that you should look for. I've been able to partner with Pampers on some forward-facing, more culturally sensitive materials. 5 things to ask your provider if you're thinking about having a baby. 5 things to think about if you see these signs and symptoms. I am firmly of the belief that in this current climate, our patients, we shouldn't feel like this, but we really have to be informed to ask questions a certain way to get the answers that we need, certainly for marginalized communities, because we know from the data that many times people feel intimidated, they are talked at, not partnered with. We're not collaborating with patients, and we have to empower patients to be able to ask questions in a way that they can receive answers. And one of the ways we can do that is say, hey, I'm still having this headache. I'm still having this swelling in my legs. I'm concerned about this. Are you? It's exactly what Serena had to do when she had insurance. She literally had to say, I have a history of DVTs. I have shortness of breath. I know the Doppler was negative, but I'm pretty sure my chest CT is going to show some clots. And so we can't expect everybody to do that, but we can partner with community stakeholders who our Black and Brown communities trust so that we can meet in the middle and we can change outcomes. We cannot expect people to come to the establishment all the time to get there because the establishment hasn't always taken care of our marginalized communities. But if we can partner with community stakeholders, like churches, like our visiting nurse partners, like our doulas, I think there should be more funding. Doulas do a lot of education. There are prenatal doulas, pregnancy doulas, and postpartum doulas. They do a lot of education in that space. So, but just broadening the way we deliver information and who needs to be the vehicle to deliver the information. It may not always be the physician or the practitioner. It may be a sister, a aunt, people in the church, people who partner alongside with you and become your foster community. Because what we want is for people to have the information.
Yeah.
And it should not be a barrier how they receive information. The other thing is, I work in a lot of organizations that have digital information, but if you don't have access to digital information, that too is not going to be as helpful, which is why I think it's really important to be in the community and partner with the community health centers, YMCA. We converted a 7-Eleven to a farmer's market, to talk about nutrition. I mean, go to where people are and spend a day in their life and how they receive information and see where we can meet people in the middle. But I agree with you, especially preeclampsia. I still meet someone every day who is shocked about preeclampsia. And then the last thing I'll say is for women, particularly women of color, who are under the impression that this is only an issue for those of us who are lower SES status, or those of us who have economic challenges. I have to say to people who look like me all the time, if I'm talking about this issue, they go, oh yeah, I'm thinking about that issue and I'm hoping to get like, no, it's you. It's you. It's your third choice. It is you, boo. And so we just really have to make sure we get everyone to understand that we're all at risk for this. All women are at risk for this. Marginalized communities are at greater risk. None of us are protected. And we all need to be collaborative in making sure we all get the information and bring all of our sisters along.
She was Latina, and she also had a higher income, college educated.
Yes.
I think we all were like, she has her health under control.
Yes. Yeah, I think that's the biggest aha for a lot of people.
Yeah.
The only thing that I would, is everything that you said, and obviously because of the partnership that we have as well. The only thing that I would add additional to that is that at March of Dimes, we actually have started to partner with local and community healthcare providers and centers. And we also we are working to do, or we have mobile buses that go into rural communities. So that is the way that we're attempting to address some of the maternity care desert areas. And that is another way that we're able to provide, well, by going into these rural communities, being able to provide information as you're going through pregnancy or be able to answer some of the questions. And so also March of Dimes has also started to partner we have been partnering with and focusing on implicit bias trainings, and then also looking at how you as the mom will be able to advocate for yourself. And so the example that I was going to share was also the example of Serena Williams as well. So it doesn't look at what your class is, financial background, or what your name is, that this is something that is impacting all of us regardless of where you are.
Thank you.
And we all are looking at using apps. That's the other thing. So there's still that, we still do have a digital divide, but we also realize that as we look at a new day and age, that there are people who actually rely very heavily on getting information digitally and using apps to kind of chart as they go through their pregnancy.
So just, go ahead.
Are there any laws that mandate healthcare providers to undergo implicit bias training on a regular basis or anything?
No,
That's a good bill.
no.
Yeah.
That might be one to write down and take back and recommend.
But just to piggyback on Stacy Bravoy's point about the apps, even though we do have a digital divide, lots of places people do have, phones that they can get the app, even if they don't have other access. So part of our Improve initiative is funding the development of new apps by small businesses. So we want more apps. We want apps that are evidence-based. Everybody out there is saying they can make an app, but there's no data to say the app is actually good. And does it work for what you are talking about? Is it culturally competent? Do you have data to suggest that what you're claiming is true? So through Improve, we're doing that also because we want to make sure we get to people with home-based diagnostic tests through wearables and other devices. Even if we can't fix the maternity care desert problem quickly, we need to detect those women who are in trouble. And if we can get better methods that work, that's where research comes in to generate those techniques, diagnostics, and technology.
Thank you so much. And this was very timely because I'm April from Apple. And so that was actually the question I was gonna ask. I was like, they must have felt it coming. But that was, if there isn't anything more that you could share around like the way that you think technology can play a role here, because I'm a former Senate staffer, but that was one of the reasons I went to Apple, very interested in all the work, particularly around like mental health and things like that. But just if you could speak more to that. And also just thank you so much for all that you all have shared, because like you're saying, it's you. I'm like, it's me. And I was just talking about that earlier. I'm like, I'm thinking about it like next year and I'm like terrified. And it's really scary. So, I mean, all that you're sharing, thank you. And thank you for all the work that you all do.
Maybe I'll start. And so maternal mental health, you mentioned, May is Maternal Mental Health Month.
It is.
It's great that we're talking about this. I'll just give you one citation for research because my colleagues are going to pick up from there. NIH-supported research found that postpartum depression, which we know can occur, is associated with ischemia or not enough oxygen getting to your heart. These things are all connected. It's not just mental health or heart disease. And that is something we didn't know before because of research. So through research, we can have more diagnostics, more wearables, more devices, more diagnostic tests that can identify, a protein in the urine for preeclampsia so we could diagnose you, but we also need to get you to care. So we need to, in my opinion, connect all these dots together in a more efficient way. And the Apple Women's Health Study, supported by Apple and NIH, are ways that, women are accessing and providing data to do real world evidence type research.
Something you said, April, just really struck me. I was just collecting my thoughts. I hate that you said that you're terrified. And I think that's a very real, I think it's a very real emotion because we're inundated with this data. We keep talking about how bad everything is and do we all need to just move? Like, what are we gonna do?
Yeah. I'm like, it's next year, my last year. Like, who do I need to say my goodbyes to? It's actually really terrifying.
So thank you for speaking that. So I think part of normalizing mental health is create safe spaces. So you mentioned about apps and you mentioned as well. And I think we really do have to normalize talking about the hard things. We have to normalize attacking this myth of the strong, magical Black woman who, that's only in Wakanda, and we're not in Wakanda. We like in DC. But we have to normalize safe spaces. And I would love to see more. A lot of this happened after the pandemic, but a lot of apps start popping up so people, especially for our young adults, so that they can access health services, normalizing being able to have those conversations. And what I would really love to see is an app that would allow people to be matched with people who had similar experiences, who maybe can communicate with you in a way that's different than the healthcare system. One of the campaigns I was able to participate in last year with Pampers and Allison Felix was Raise Care, Deliver Joy, because we should be able to have joy during our pregnancy. You should not have to go through your whole pregnancy worrying that you're gonna die or worry that once your child is here, they're gonna die. And so we should be able to have joy during our pregnancy. And I think we have to balance that message with delivering joy, empower ourselves, yes, educate ourselves, yes, advocate, yes. But also we deserve to have joy during the pregnancy and we deserve to believe we're going to get to the finish line, just like every other person experiencing pregnancy should. So thank you for naming that. Thank you for bringing to the forefront mental health, because we've all been kind of talking about the strategies of just naming what a big deal it is, naming that it's a big predictor of adverse maternal outcomes. And also, even if you don't have an adverse outcome as a result of poor mental health during pregnancy, if you have postpartum depression, if you have postpartum anxiety, if you have post-traumatic stress and you're trying to raise your child's development is imprinted by that, because we don't give mothers safe spaces to say, hey, I'm not okay.
Well, so first, I just wanted to affirm you, sis. I turned 38 on Thursday, and I've already made the decision in part of this work to just go ahead and freeze my eggs and explore other options. So in the spirit of vulnerability, just wanted to share that, because race is the deciding factor here. And so I guess my question is, it's a bit of folds. One, so my name is Lauren. I'm political director at Sojourners. We're an ecumenical Christian organization. And at least the way that I am addressing maternal health, in particular the Black maternal mortality crisis, is focusing on racism as the deciding factor. Really leaning in on weathering and intergenerational trauma. But I think one of the, some of the pushback that we get a lot is obviously anytime you focus on racism, people freak out. And I'm going to be very blunt here. Oftentimes when you say put Black in front of something, people automatically tune out. And so since Sojourners is relatively new to the work, and of course I have my own personal feelings about racism, and then obviously the professional leaning into, since you guys have sort of been in this game before, so what are the challenges that you guys have faced around messaging? Of course, I'm seeing a lot of, well, why are you creating a system for Black women? To which we quote, when one person suffers, we all suffer. When one person rejoices, we all share in the joy. But that's still a very real message. And I know we're going to get that as we dig into the Hill. And so was wondering just how some of what the pushback is, and maybe from a unique perspective, how faith groups who are addressing sort of the sin of racism can really help play into some of the messaging and the work that you guys are doing.
That was like 5 questions, sis.
Answer the one that made the most sense.
First I'll say it's a very good question, and it's a very valid question that we have to navigate when we're doing this work. The way I like to address questions like that is that this is a systemic problem that's going to require systemic issues. We all are going to be impacted by it. We saw that during the pandemic. We saw the Black and brown communities were impacted the most, but everybody was impacted by the challenges that we had to navigate. The other thing I try to point out, as I did try to show an example with the bias slide, is that systemic issues impact every aspect: healthcare, education, criminal justice. It impacts us everywhere. Those of us who are advocating doing this work are impacted by it, even in ways we don't even see. And I think the best example that we can look to is if you look at where the United States ranks in terms of other developed countries, in terms of maternal mortality and infant mortality. Even if you remove all of the Black and brown persons who may be not making our data look too good. I mean, like, even if you remove everyone, we're still not #1. We have more doctors, we have more hospitals, we have the best healthcare system. I mean, like, we have the best of everything, but we're not the best in terms of how long we live. We're not the best in terms of our adverse outcomes. And so if we are the best on this side, we should not be having an average lifespan that stops in our 50s, 60s, and 70s, when other countries are actually getting better, we're getting worse. And so even if we remove those things, our majority colleagues, friends, families, everybody, our cohorts there, we're not #1. So everyone is impacted by this problem, and it's weaved through all of our systems. And if we take the best care of our most vulnerable, if we take the best care of our most marginalized, everybody benefits. Everybody benefits. Everybody gets better when we take the best care of our most marginalized. And we've seen that before in our history in the United States. So everybody gets better when we take care of the most fragile. And at the end of the day, we're talking about infant mortality, somebody who deserves to make it to their first year of life. And if we can't guarantee that a baby can get to their first year of life, then what for the rest of us? What for the rest of us?
And so, Lauren, I would probably just tag just one additional thing there. I think that when you're having these conversations, I would probably definitely lead with that information, which is the statistical numbers that talk about this impacts us as a country. And for us to be #1 in one of the most well-developed countries in the world, I start with that. And then once you're able to start with that, then you can bring in the rest of the data. And so when I have, and I understand what you're saying, because my job and my role with my team, it is navigating in those spaces, right? And a part of our job, I mean, we're nonpartisan organization, but what it is and how you engage people and how you begin the conversation, I think you have to start out with the data that shows how it impacts us as a country, or why it impacts you or someone that looks different than you, why they should care. And then you bring in the additional statistical information and talk about Black, Brown, Asian, Island Pacific communities. But I think you got to lead with how it impacts us universal, how it impacts us and how we look to the rest of other nations. And then you lead in with the rest of the information. Because as you've stated, if you say Black first, you may alienate some segment of who you're trying to have the conversation with. And the truth is, you don't want people to have implicit bias where they shut down when you use those terms. So start with what is, I won't say most important, start with where you know everybody's going to agree, the data says, and go from there.
Awesome. I'm going to pass it over to Cindy for one moment for a brief introduction.
I'm very pleased to introduce Congresswoman Lauren Underwood, who has joined us. She represents the 14th District of Illinois and serves on the Appropriations Committee. She is a registered nurse and co-founder and co-chair of the Black Maternal Health Caucus, which advances policy solutions to improve maternal health outcomes and end disparities. Congresswoman.
Hi, everyone. It is so good to be back with the Women's Congressional Policy Institute to talk about my favorite topic, which is Black maternal health. I am so sorry to stop the conversation that was obviously happening. I feel like we were getting to the good part. Everybody's minds were pinging, and so I'll be really brief, but thank you all for being here, and to my colleague Amelia Sykes for your leadership. I'm Lauren Underwood. I'm the co-founder and co-chair of the Black Maternal Health Caucus, and I'm so pleased to be joining you for this conversation on maternal mortality in the United States. I also want to make sure that we don't move past the bipartisan leadership of the Women's Caucus here in the House, Congresswoman Susie Lee and Kat Kamik, and then Vice Chairs Amelia, obviously, and Monica De La Cruz. Thank you all for elevating our nation's maternal health crisis as an urgent issue that the Congress must address with comprehensive evidence-based solutions. And that means that we have to pass the omnibus. Now, the omnibus is a sweeping set of 12 bills that build on existing legislation to address every driver, clinical and non-clinical, of our nation's maternal health crisis. We first introduced the omnibus in the 116th Congress with Representative Alma Adams and then Senator Kamala Harris. But ever since, we've been working to get these bills signed into law, and we've made some significant progress, including the first omnibus bill being signed in November of 21, the Protecting Moms Who Served Act. And it's bipartisan, and it includes really important investments to improve maternal health care for veterans. We also secured funding for omnibus priorities through the fiscal year 23 federal funding package. But we know that there's so much more work that's needed, and that involves passing the entire omnibus, including investments to grow and diversify our perinatal workforce, address social determinants of health, housing, nutrition, transportation, environmental conditions, expanding access to maternal mental health care, which is the #1 cause of maternal death in Illinois, supporting community-based organizations who have been on the forefront forever, doing the work when no one else wanted to talk about this, or very few people wanted to talk about this. They've been leading us forward. As you know, that we have some issues with data collection and data standards, right? We need to clean that up. And we need to advance research in this topic. So we have to get these life-saving bills signed into law this year. We can't wait any longer. I'm an optimist. I think it's possible. I think the brain power in this room can help us develop a strategy to get there. And I really do look forward to working with my colleagues on both sides of the aisle to get these investments secured so that families and our communities can have the resources that they need, so that every family can enjoy the blessings of motherhood, can enjoy the blessings of being together. And as we look ahead to Mother's Day, we believe in the Black Maternal Health Caucus that every mom should have access to high quality care and support before, during, and after pregnancy. That shouldn't be something that's afforded to people only in cities, only in wealthy areas, right? These should be afforded to every mom. So I'm really thankful for your shared commitment to these priorities, to this issue, for those who haven't done a lot of work on this topic, for your curiosity and you're willing to come out and hear from these experts. And thank you, ladies, for coming to Capitol Hill to speak the truth and to share your perspectives on where we need to go. I really appreciate your time and thanks for having me.
Thank you. Thank you for your support on this issue as well. I think we may have time for a couple more. Okay. Here, purple.
And then this lady to the right has been waiting a long time.
Hi, I just want to say thank you again for this wonderful discussion. My name is Destiny West. I am the founder of the Drake Institute of Women's Policy. We are a nonpartisan think tank based here in DC. I started the Institute because I am a 3-time now survivor of ectopic pregnancies. My life was threatened each time. 2 were fallopian tubes, the other one was an ovarian ectopic pregnancy. Each time I went through my experience, I will say to you, it was very traumatic, but what made it worse was when I had to interface with men in the process, from doctors who were in charge of my care, even after being released, even just dealing with the men in my family who just didn't get it. So my question to all of you is, what are we doing to engage men in this conversation, to get more support, to just get more awareness out there, to increase more awareness among them, and of course, men in Congress and just positions of power?
You want to go first? You look like you got, you gave me the eye like you want to go first.
I want to know the answer to. So I can share some of the things that we have been doing at March of Dimes specifically. And we have been intentional in terms of reaching out to have our advocates involved in our process when we've looked at doing things across the state and at the federal level. We invite fathers to come in to share their stories. We use, and I won't say use, we encourage fathers to understand that having them take a part or sit at the table to be able to advocate is something that is very vital to being able to push for some of the policies, but also changing the narrative when we have the conversation. So it's not just the moms, but it's the dads as well that are talking about what this impact and what has happened. We worked very closely with a father who lost his wife in childbirth with their second child. His name, and a few of you may be familiar with the name Johnson. I'm going to skip his. Charles Johnson. Working very closely. Yeah, working very closely with Charles Johnson and being able to tell that story. His story is a very powerful story. He's partnered with the March of Dimes. It has been a way that we have been able to tap into those advocates, those fathers that are advocates. And then we have started to see, and I've started to see since being at March of Dimes, that there has been an increase in the male advocates, the dad advocates. And it doesn't necessarily only be the dads. Sometimes it's the grandfathers who have lost their daughter in childbirth, or they have been there for the mom, the daughter, going through their experience through the pregnancy. So we have started to focus and be more intentional with being able to bring them along and making sure that people see their face and tell their stories. And what I will share with you is we just recently had our federal day or federal fly-in, and there were several fathers who came, but there was a gentleman that rode on a bus from Atlanta, Georgia, who found that it was important for him to come and join us for our federal advocacy day to share his story. And there were several men, and his story was because he lost his sister when she was giving birth. And so he felt moved and he wanted to participate. So I think it's important that we get men to tell our stories. I will also say that I don't believe that dealing with maternal and infant health crisis is just a mom or a mother's issue or a women's issue. It is, it's across the spectrum. And I think that is evident also in the congressional members and senators who are sponsors for our pieces of legislation. For PWFA, if it was not for Senator Cassidy and Senator Casey, we would have never been able to bring that to the floor last year to be passed. And that also included the Pump Act. So I think I would encourage you all to encourage dads to become a part of the conversation, which is what we're doing at March of Dimes. But I also need to just flag that a lot of the legislation that we're able to get passed is because women in this room, women who are watching via live stream, are having conversations, and their family members are having conversations, and thus males are listening and understanding what the impact is. Because guess what? We all have a what? Mom.
I would just add to the specific point you brought out about even your partner not being as aware of the challenges of dealing with the loss of a pregnancy. We do need to do more in the women's health space to be more inclusive. So it's something that I see in the NICU all the time. The dads don't feel as welcome as the moms when they visit the ICU nursery. When we were doing the preconception training for college students, we had special classes to get the football players to come so that they could be aware and so that they can know what questions to ask. So I do think that there's a huge opportunity for us to be more inclusive for everyone who's in the family, everyone who's going to be supporting this journey. Even in the church, when we were doing the centering pregnancy trainings in the church, we had to make an extra effort to make sure that our males knew that they needed to come too and that we wanted them there. But, you know, like if you walk into a waiting room or you walk into a place and you see nothing that says we want you here too. I won't start stereotyping, but my husband has said this a lot. So we just need to be more mindful and inclusive. So I appreciate your question. And I do know that the California Collaborative, I know that they have a special like fatherhood initiative that is an online forum for dads to kind of process and stuff. Thank you for the question.
Thank you. Hello, Mindy Walker. I'm with Airflow Healthcare, which is a DME company. Thankfully, I'm their first ever government relations staffer, but thankfully 99% of what I do isn't to directly benefit my company. It's tax elimination on diapers and breast pumps and items like that, as well as really trying to help women as best we can to breastfeed and et cetera. So I have a little bit of a statement to my very, very sweet table mate here. And in addition to what Stacy said earlier, I know I don't look like it. I am like half Korean, fresh off the boat, quarter Black and a quarter white. But I'm pigmentally challenged, very much so. But when we're talking about race, I think it's very good to recognize that people have their hearts in the right place. While there are health issues that are very connected with race, I think it's not helpful to move things forward when we bring up the word racism, because I think that people who might not share your heritage are very open to helping out on these initiatives. But the second they hear that word, they're like, you know, I can't touch this. So I just think that we can do better at communicating and using our words and bringing up these serious health issues that happen to be connected to race, and then kind of floating into that because of my heritage, like Asian women they're much less likely to breastfeed. And so I was a formula baby, but something that we're working on is, you know, Medicaid issues in the states. A lot of states have their WIC offices determine formula or breastfeeding and helping with breastfeeding supplies. The NIH has done a lot of great work on studies that have indicated that breastfeeding does not only benefit the infants themselves, but also reduce cancers in women who have breastfed. And I just kind of would love everyone to be mindful in the states, since this is a federal program where states are the ones that are doing it. A lot of WIC offices are basically not providing the assistance on the breastfeeding component. They want to go formula. And again, formula is great. I was a formula baby, but I just think it would be great for people to be mindful when they're going in and talking to legislators and other decision makers that we should encourage breastfeeding. It's a lot less costly overall. On the front end, it's very expensive, but in this time of great inflation, I think it's just very helpful to work on these issues. And I would love to interface with all of you on some of these initiatives, but I just kind of want to put that out there since it is important to maternal mortality in the long run. So thank you.
Thank you for sharing. Well, oh,
At this table on the back, right here. Yep, right, the classes, yes. Well, yeah. I hope it ain't a question for me. I'm just kidding. But I just saw your hand up and I wanted to make sure it's been up for a while.
And I want to go a little further at what she just brought up is that, and there is research out there that indicates that, and mine was in mental health mainly, that the medications that are being given to the moms, and we really need to support them, that it passes through breast milk. And it can cause a lot of damaging effects, not only on the baby after it's been born, but in the formation of the baby's brain while they're during their gestational periods. And so if more support was given to them and it wasn't an instantaneous, let's throw medications in those areas, they would be able to have a much better outcome, because the medications then can have an effect on the child to have severe mental illness for the rest of their lives. And so more of this information needs to get out there to help to make knowledgeable decisions and to also give them the support that they need. And I'd like to see if there are other agencies that are willing to, work on those areas to help them as they go along that path.
thank you.
Okay.
So the only comment that I wanted to make to your statement is the reason that that I mentioned earlier is that I'm encouraging people to take a look at the advancing safe medication for women and for moms. Is actually called Advancing Safe Medication for Moms and Babies Act. And what that is where the FDA is looking at establishing national clearinghouse of educational materials, creating and coordinating federal activities and raising awareness for patients and providers to look at the medication that's being prescribed to women who are pregnant or lactating. And so our chief medical officer has started to spend more time at March of Dimes talking about, she has seen, I'm sharing this with everyone, she's had patients to come in, you could probably talk about this as well, having patients to come in and they've stopped taking their hypertension medicine, or they're not taking things because they're not educated or have all of the necessary materials in terms of what medications they can still continue to take while they're pregnant. You just tend to think, oh, I got to stop taking everything. And that's not the case. And so I believe that is the reason we will see a reintroduction of the Advancing Safe Medication for Moms and Babies Act. And so I just encourage you all and encourage you to just thumb through the legislation, take a look at it, because that may also be a way to look at how you educate people on that and the impacts of medication on unborn.
And very,
I appreciate that. Part of the problem, though, is that the clinical trials, doctors do not have access to them. And this is a big problem in the country.
I just want to add that Congress actually requested HHS create a maternal mental health task force this past year. And that has been formed and will be addressing some of these issues, as well as the task force on pregnant and lactating women, which is speaking about what research we need so that we will know what medications are safe for pregnant and lactating women. So we need to address the maternal mental health issue, as well as the safe medications for pregnant and lactating women as companion issues.
Awesome. Thank you. Thank you. Well, hey, one hot take in 1 minute or less. What is one of the key takeaways you hope this audience and those watching online will leave with today? I'll start with you.
High quality obstetric care for all women everywhere, every day is one of the most critical ways we can improve the health of women in the United States and reduce maternal mortality. Research shows that when high quality care is delivered, we have better outcomes. So the evidence shows we just need to work together to be able to connect the dots to get that evidence to each and every woman every day, everywhere.
one take. You guys probably already know I can't say one thing. So I would just like to say that this issue of maternal mortality and infant mortality is a systemic issue. It's going to require systemic solutions, all of us working together all the time to raise the standard of care and deliver joy so that we all have the opportunity for the best outcomes. And that even when we do what we can in the hospital, we have to make sure that when people go home to their communities, that they still have transportation, that they are making a good living wage, that they have access to nutrition, and that bias it weaves through all of those decisions. And so things like implicit bias trainings through martyrdoms, through Pampers are helpful. And the last thing I want to say about implicit bias training is that it's not a checkbox. It's not a, oh, I did it and 400 years of bias gone. No, it is, we have to have accountability. We want to have accountability. We want to have quality measures. We want to have tracking. Is what we're doing making a difference? And if it's not, then we need to do something different. So I love being able to partner this discussion with the advocacy and the legislation that will change the outcomes for futures to come.
My takeaway that I'd want everyone here and watching live to take away would be, it's going to take all of us, regardless of what your zip code is and where you are physically located, to work together to be able to advocate, to encourage policies, as you can see, legislation. And that's why we're here, here on Capitol Hill in Congress, having this discussion, because we want to be able to raise awareness. So I think the takeaway would be, regardless of where you are, it takes all of us. It's important that you're able to advocate and understand that legislation and raising awareness to maternal and infant health is important, and everybody can play a role.
Awesome. Thank you to our amazing panelists. Can I just give a round of applause? Thank you to all of you for your thoughtful questions. And I hope that we all continue to serve as maternal health advocates and allies in this space moving forward. And I will move it over to you, Cindy, to close out.
Yes, echoing what Jasmine had to say, thank you so much to our wonderful panelists. And thank you to Jasmine for doing a great job moderating the panel. Thanks to everyone that asked questions. Some really great issues came up. And of course, thanks to our women members that came and spoke as well. There clearly is significant interest in improving maternal health and reducing the high and tragic rate of preventable maternal mortality in this country. We hope that our speakers' insights and personal experiences will contribute to successful bipartisan solutions to many of these challenges. And we've heard a number of proposals that people can look at. This conversation was recorded and should be available for viewing on our website at wcpinst.org tomorrow. And we talk about a survey that we were going to put on chairs and I realized did not happen. There are surveys outside in the room, so please grab one. We also want to invite our Zoom participants to respond. Of course, our thanks to Procter & Gamble and Pampers for their support for this briefing, but also their work and initiative to prevent maternal mortality and improve maternal health outcomes. Thank you for everything you do. And I think I've thanked everyone that I can think of, except for one very important thank you to Afnan Adam, Elsha Amero, Alina Sangosh, Serena Oshiro, and Ashwarya Grande for their work to make this briefing possible, the WCPI team. Thank you.
Thank you.